we go to question number 2. So define the following terms. The first term is pharmacokinetics. The second term is biotransport of a drug. Then part B of the question says describe the passage of a drug across a biological membrane under the following subheadings. That is passive transport and then specialized transport. Then part C says define drug absorption. So we go to the first part of the question. Define the following terms. Pharmacokinetics. So from the word pharmacokinetics, you can split the word into pharma and also kinetics. So we know that kinetics has something to do with motion. So that is the movement of a substance. So pharmacokinetics refers to the study of absorption, distribution, and metabolism of a drug. That is the study of ADME. Then we go to another one which says biotransport of a drug. So this refers to the translocation of a drug from one side of a biological barrier onto the other side of a biological barrier. Then we want to describe the passage of a drug across a biological membrane under the following subheadings. So the first subheadings is passive transport. Passive transport. So when you look at the word passive transport, passive means it is not being aided by anything. So we can categorize passive transport into two. So we have a simple diffusion and also filtration. So what is simple diffusion? So simple diffusion refers to the movement of a drug from a region of a higher concentration to a region of lower concentration. So simple diffusion does not require any energy. This is because the drug is highly lipid soluble. Then we have filtration. So we can get the word filter from filtration. So what do you think are substances that can be filtered? So this refers to the substance must have lower molecular weight and also it must be water soluble. So filtration refers to the movement of water soluble drugs, that is across a biological barrier due to existence of hydrodynamic pressure. That is the movement of a drug across a biological membrane, and this drug must have a lower molecular weight and also highly soluble in water. So because the drug is highly soluble in water and has lower molecular weight, it can easily be filtered due to existence of hydrodynamic pressure difference across the membrane. So the examples of such drugs includes, that is urea and ethylene glycol. Then we have specialized transport. So from the word specialized transport, it means that this one is special in that it is aided by something. So specialized transport includes the following. So number 1 is active transport, number 2 is facilitated diffusion, and number 3 is endocytosis. So we begin with facilitated diffusion. So facilitated diffusion refers to the passage of a drug across a biological membrane with the aid of protein carriers as a means of transport. So that means that the higher the number of protein carriers, the higher the rate of facilitated diffusion. Then we look at another part of specialized transport known as active transport. So active transport, what is active transport? So active transport refers to the diffusion of a drug or movement of a drug across a biological membrane against a concentration gradient with the expenditure of energy. So active transport is also aided by biological carriers, that is the protein carriers. Then endocytosis. Endocytosis, from endo means into. So endocytosis involves invagination of a membrane, of a cell membrane. So the cell membrane invaginates and takes in substances. That is, substances are entered into the cell through invagination. That is endocytosis. So such substances involves the proteins and toxins. Then we go to the last part of question 2. Define drug absorption. So what is drug absorption? So drug absorption refers to the entry of a drug into systemic circulation from the site of administration through a biological barrier. So I repeat question number 2. The notes, that is pharmacokinetics, refers to the absorption, distribution, metabolism, and excretion of a drug in the body. Then that is transport of a drug. Biotransport of a drug refers to the translocation of a drug from the site of a biological barrier to another. Then another part is the definition of to describe the following parts of movement of drugs, that is passive transport and specialized transport. So passive transport includes simple diffusion, which I have said is the movement of a solute through a biological barrier from a phase of higher concentration to a phase of lower concentration. So this does not require energy, as the drugs are highly lipid soluble. Then another part is active transport, which is the passage of a drug across a biological membrane against their concentration gradient with the expenditure of energy. Then the third part is endocytosis. So this one involves large protein molecules that are engulfed by the cell membrane and are released intracellularly, that is inside the cell. So such molecules are proteins and toxins. Then part number C says define the drug absorption term. Drug absorption. Drug absorption refers to the entry of a drug into systemic circulation. So that is the entry of a drug into systemic circulation from the site of administration of the drug through a biological barrier. Then we go to question number 3, which says state and explain the major sources of drugs. State and explain the major sources of drugs. So the major sources of drugs includes plants, animals, and also minerals. So we begin with plants. So plants have been major sources of drugs for a long period of time. However, these plants have been replaced with synthesis of the prototypes, that is substances that resemble those ones that are extracted from the plants. So such drugs include, that is the cardiac glycosides, and these ones are normally obtained from the barks of the plants, the leaves, and the fruits. Then other substances also include tropane alkaloids, which are commonly used as antiplasmotics. Then we also have animals. So few animal products are in use today for the treatment of infections. Steroids, insulins, and heparins are examples of animal products that are used for treatment of infections. So I repeat, the importance of plant sources have declined due to replacement with synthetic compounds. Examples of drugs developed from plant sources include, that is digitalis for cardiac condition. The current cardiac glycosides have been developed from original compounds. Then tropane alkaloids are another example of drugs obtained from plants. They are commonly used as antiplasmotics, so they are found in leaves, roots, barks, and fruits. Then we have animals. So in animals, a few animal products are in use today for the treatment of infections. So these include, that is steroids, insulins, and heparin. So the prototype drugs of compounds occurring naturally in animals, such as steroids, contraceptives, medicinal estrogens, progesterones, and androgens, have been synthesized. So we continue with question number 2. Other sources of drugs includes minerals, microorganisms, and also synthetic sources. So minerals that are used in the synthesis of drugs includes potassium ions, that is potassium minerals, sodium minerals, and also iron and ion compounds. So these minerals are normally used in the synthesis of drugs because they can be used to correct electrolyte imbalance, that is as intravenous infusion. So examples of such drugs include, that is the Hartmann solution, Ringer's lactate, and normal saline. Then we have microorganism. So microorganisms are sources of majority of antibiotics. So antibiotics are normally obtained from microorganisms during their growth. So examples of drugs that are synthesized from microorganisms include penicillins, macrolides, and tetracyclines, among others. Then another source of drugs is synthetic source. So synthetic source is replacing majority of the sources that I have highlighted above, because scientists have come up with methods of synthesizing drugs instead of just relying on plants, minerals, and so forth. So examples of synthesized drugs also include those antimicrobials, because they are synthesized from microorganisms. So it is important for you to know that antimicrobial drugs are synthesized. So another example is antihypertensives, tranquilizers, and antidepressants. So part B says, state and explain the factors which determine the route of drug administration. So which factors determine the route of drug administration? So the first factor is the desired rapidity of a drug. So an example is a drug that is used for treatment of a heartache is more crucial as compared to a drug that is used for the treatment of a headache. Then we also have another point which says the desired site of action. So an example of this is the drugs that are used for treatment of peptic ulcers. We know that these ones are used in the stomach. So examples of such drugs are magnesium trisilicate and also aluminum hydroxide. So since they are used for treatment of peptic ulcer disease, and they are found and the disease is found in the GIT, we use the oral route. So that is the desired site of action. Then we have physiochemical properties of a drug. So some of the drugs are irritants. They can cause irritation in the site of action, so we might decide to use a different route of administration. Then we have some drugs that undergo fast pass metabolism, while others are irritative, as I have just said. Then another factor is the pathological state of the patient. So we have patients that are unconscious. Then there are those ones that cannot move, they are immobile. There are those ones that are vomiting. So we look at those factors before administering a drug. So a patient that is vomiting may not be required to use that is the oral route, because he might vomit the drug. So we might use another route of administration. Then some patients also have malabsorption syndrome. So if a patient is suffering from malabsorption, you might be required to use a different route of drug administration. So part C's questions reads, what are the major routes of drug absorption? So the major routes of drug absorption are enteral routes. So enteral routes includes the oral, the sublingual, and the rectal. So they involve the GIT route. Then we have parenteral. Parenteral route bypasses the GIT route. That is includes intramuscular, intraperitoneal, or intravenous. Then we have the topical route. Topical means on the surface of the skin. So some drugs are normally applied on the surface of the skin and they are absorbed there. So we can also talk about mucous membranes. So when you talk about intranasal, intravaginal, intraurethral, so these are parts of the topical route. Then the last part of the question reads, explain each of the routes in C above, stating the advantages and disadvantages of each. So we have oral route, that is the GIT route. So drugs are administered through the oral route by swallowing. So drugs administered are tablets. We talk about suspensions and capsules. Once again, let's go through our notes. We say that the sources of drugs, apart from the plants, we have minerals, microorganisms, and synthetic drugs. So minerals are ferrous and ferric compounds. So these ones are ion compounds. sodium and potassium are in common use today. Some of the mineral compounds are used as intravenous infusion for correcting electrolyte imbalances. So examples include normal saline and Hartmann's solution, and also Ringer's lactate. Then microorganisms. These are sources of antibiotics or antimicrobials. So these substances are produced during the growth of microbes. Antimicrobial drugs include penicillins, tetracyclines, aminoglycosides, macrolides, and erythromycin. Then we have synthetic drugs. So majority of modern medicines and chemical compounds do not occur naturally, but are synthesized by chemists. So examples are antimicrobials, antihypertensives, tranquilizers, and antidepressants. So number B says, state and explain the factors which determine the route of drug administration. State and explain the factors which determine the route of drug administration. So we have desired rapidity of action of drugs. So some drugs may be required to reach their site of action faster than others. E.g., a heartache drug may be more crucial than a drug for headache. Then we have the desired site of action. For example, magnesium trisilicate and aluminum hydroxide, which are designed to treat peptic ulcer disease, are taken through oral route. Then we have physiochemical properties of a drug. E.g., in the gut, some drugs can be easily hydrolyzed. Some undergo fast-pass metabolism, while others are irritative. Then we have this question that reads, what are the major routes of drug absorption? So what are the major routes of drug absorption? And by the way, I have skipped the pathological state of a patient. So the immobile or unconscious state of a patient, vomiting, malabsorption syndrome, determine the route of drug administration. So the major routes of drug absorption are entero. So these are drugs are deposited in the GIT, oral, sublingual, and rectal routes. Then parenteral, which bypasses GIT. So the routes include intramuscular, intraperitoneal, intravenous, etc. Then we have topical route on the skin and surfaces. Then we have mucous membranes. This includes intranasal, intravaginal, intraurethral. So this is a part of topical route. So we are going to continue with questions and answers in the next episode. Thank you very much for paying attention in this class.